So hey everybody, I'm Leslie. Some of you have met before and some I haven't, but thank you all for joining. On here, just so you guys know, is Lori. She is a new labor rep and she's based out of Missoula. So her and I are probably going to be working with you guys together. And then I would assume, Lori, both you and I are going to be working with the CMC nurses together too. So we're going to kind of double team the Missoula locals. So good luck, you guys. You got two of us now. So she's on to kind of listen to what's been going on and just see how we do this. I kind of planned this meeting out, so we'll talk a little bit about what got us to this point, kind of the background, a little bit of history. We'll go through the MOU. It does have one little change after bringing some of y'all's concerns to the management team. We'll talk through all the pieces of that, and then I have a list of questions that came from all the Facebook chatter, from some one-on-one questions from different nurses, and things like that we'll answer. If you guys have questions beyond what we go through, I think I have about 12, pop them in the chat box, or you can ask them at the end, and we just want to make sure we answer everybody's questions and give you guys whatever information will help. So let's get started. Mary,
I'm having trouble hearing you.
Is anybody else having trouble? Am I not loud enough? Does that help?
I don't know if it's your microphone or what, but it's cutting out.
Is that any better? No. Well, it might be the connection, and so we might just have to do our best, and Mary might have to help do a lot of this. No pressure, no pressure.
No pressure.
Can you guys hear her better?
I don't know. Can you hear me now?
Yeah, Paul can. I see Megan put a thumbs up. I think they can hear you better. So I'm going to start pulling up.
Yes, she's much louder.
Oh, great. Thanks. Mary,
What else is new?
Do you want to start talking a little bit about like how we got to this, like how this discussion was brought up, and how this MOU got brought to us while I pull the document up?
Well, I wish I was with details and times, but administration had come to us back in, was it April, March, after we'd had during when everything was shut down and the departments were closed, and was concerned and wanted to have a plan or ask us about helping with a plan for what they could do or utilize if they had to cut back again. And they had talked about one of their biggest concerns was their biggest concern for starting this was mandatory low census, and only being able to use or give 12 hours a month in a time when if it got very slow again, as opposed to, and what we were told, not specifically that I remember, Leslie, jump in if you remember, but they said as opposed to using layoffs to cut back staff, they wanted us to try to work together to come up with something for the emergency COVID.
Yeah, that was definitely part of it. I'm going to try and talk fairly slow, so if it cuts out, it's not as hard to understand. But they were looking for increased flexibility to try and deal with the lower censuses in the hospital so that they could avoid having to utilize layoffs or mandatory reduction in hours. So they were trying to find a way to be flexible. And they came to us with this MOU that had a lot more MLC on it. It had the idea of a COVID low census. So you could be low census because of COVID, but it wouldn't count towards mandatory low census, plus an increase in mandatory low census. Like there was a lot of things on here that the officer group would not agree to. And through the whole process, firmly stood their ground on saying, this MOU, if it's going to be accepted, it's going to be voted on by the nursing body, not just accepted by the officers. So that's where this came about, and that's where the initial vote came about. I don't know if my audio's getting any better for you guys. I got it. So that's where this came from. It came from a place from management, for one, from a place where you guys were experiencing significant low census, where people were being furloughed, where nurses were being offered furlough. And I know at this point, census has improved and it has changed, but there are still employees at St. Pat's who are being furloughed on a week or two at a time basis. I think it's mostly management level, but they're still in a cost saving mode. Go ahead and keep talking. I'm gonna redirect my daughter out of my office. Go ahead.
Oh no. What else? So this, like I said, now where we're at, it seems like we're back and we're busy and you know, what is the point? It takes a long time to set up these Zoom meetings and go back and forth to get administration and Charlie, the attorney, and us all together for a Zoom meeting. So part of that is why this is coming now. Part of it, I want to say, and Leslie, remind me if I'm wrong, that it had been, I don't know, a few weeks, a month, when we had finally told them, because they were sticking to, there was no way they were going to take our last pass of 24 hours of the low census as opposed to what they were asking for, 36 or something like that.
Yeah.
And then finally, late afternoon, a few days, just a day before we put out this vote, Charlie, the attorney at with management, had said, yes, we'll accept your offer. And we needed to get it, of course, out to you as quickly as possible because it's always in a hurry.
Right. And on that, like, it took them at least 3 weeks to get back to us on when we finally said, look, this is all we're comfortable with. We're not going any further in any other direction. And that took them 3 weeks to respond to. So there was a lot of stalling for multiple reasons, and it took a long time to get to this point. And it seemed like once we got to this point, we were like, yes, okay, we can get this out. And in hindsight, obviously, we had got it out too quickly and moved too fast. And there was so many questions and things that came out of that, which I'm super thankful for because it helped us to clarify some pieces. But now we're wanting to re-present this to you all and then have everyone re-vote. So that's kind of what this process is, so that we can look at it again, look at it together, answer all the questions that we could find that came out of this and any that come up in this call, and then we'll do a vote next week. Okay? So that being said, thank you, Mary, for all of that. I'm going to start going through this MOU. Now, can you guys see this document up on the screen? Did it pull up for you guys?
It did. I can only see the top. I'm gonna make
Yeah.
it small.
I haven't scrolled down yet. So you probably
That's why. Because I can't then.
Yeah, because you can't. Correct.
Okay.
Okay, so we're just going to go through this paragraph by paragraph and talk you guys through it. And then once we get through all of this, we're going to talk about the plans for the vote. And then we'll go through the list of questions that I have and then whatever questions you all have to add to it, okay? So this top piece is just kind of generic, fairly generic language on MOU. So it's basically stating that the hospital and MNA Local 17 are parties to a collective bargaining agreement, your contract, and that both parties agree that there's a public health crisis that's created special circumstances affecting the operations of the hospital. As such, the parties agree that a temporary modification must be made to the working conditions of the nurses, some of which may conflict with the language in our agreement. So the reason why we're creating an MOU is because the language in this does not match the language in the contract, and that this MOU is temporary. It's not going to be moved into the contract. It's just a temporary agreement for a certain period of time. Acknowledging the parties, acknowledging the patient census volumes have reduced due to COVID, and that the hospital seeks to avoid involuntary staffing reduction measures, meaning layoffs and mandatory furloughs and mandatory reduction in hours, the parties agree to the following. So these are an agreement to avoid mandatory reduction of staff, okay? The first bullet point is talking about redeployment. It says the hospital will continue to work to redeploy nurses to other departments or roles, given that the registered nurse is trained to perform such work and the work does not exceed the scope of practice for RNs in Montana. If such redeployment is not possible, the hospital will continue to seek volunteers for low census as per the terms of the collective bargaining agreement. So if there's a need in another unit and one unit needs to be low census, the goal is to redeploy nurses as possible. Meaning if you're trained to work in that department, if you're trained to answer call lights, if you're trained to answer phones, if you're trained to take temperatures at the front door and there's a need for that, they're going to try and utilize the staff they have to fill the needs that are available. This is very specifically saying that if you've not been trained to do a work and or that work exceeds your scope of practice, they will not be and should not be assigning you any of that work. If there's any question of that, your officers and I expect to hear about it immediately. So that, and there was a lot of discussion about this. Mary, you can speak to that too. There was a lot of concerns from the officers and a lot of discussion about this issue of redeployment. This is not agreeing to float a nurse into a situation that they are not trained for, to perform work that they are not trained for. That is not what this says. So please don't feel like that's what this is saying. It's to redistribute the work. If there's like a ton of COVID patients in your COVID unit and there's no surgeries happening and they need a unit secretary or someone to help restock supplies or an extra body on the unit because there's so many isolation rooms, you can do that. But as like an OR nurse, you're not going to be expected to take a team of patients on the COVID floor without being trained first, okay? So moving right along, mandatory low census. This is a hot topic, absolutely should be. So this is an agreement that for the period of this MOU, that nurses working a 0.75 will have a temporary increase of up to 24 hours of MLC per month. Nurses working a 0.5 FTE or greater, or less, will be 16 hours of mandatory low census per month. And that's through February 31st, 2020. We've added language in here about the Family Maternity Center. And there's some rationale behind this, and Mary, you can speak to it too, but the nurses in FMC almost every single month of the year get their 12 hours of mandatory low census. It is the way that they practice. It is the way that they have patients that come in the middle of the night and their census goes from 0 to 500, not really, but it fluctuates very, very rapidly because women walk in labor and you can't find them anyways. And so for MLC right now, if we enacted this increase in MLC, that department would almost certainly get MLC'd up to their max as often as possible. And they're already experiencing that. There are nurses in this department who get MLC'd so much that they don't make up enough PTO to cover it. So every month they're losing money. So we had this conversation during bargaining. We had this conversation during pre-bargaining. We've had this conversation with MLC on FMC for, gosh, as long as I've been with MNA, so almost 3 years. So bringing that concern after talking with FMC nurses, then bringing their questions and concerns forward, we brought that to the management team. And knowing that they've been a part of this conversation for at least 3 years, they agreed to this provision to exclude the FMC nurses from the increase in MLC. This is the only section where they're excluded. All the rest of this stuff applies to them. So if they can be redeployed to take temperatures for, half of a shift because they're not needed on their floor, that's possible for them too. So there's that. Next bullet point is talking about furloughs. So this is talking about voluntary furloughs. Nurses can be given the option to request a voluntary furlough lasting 1 week or multiple weeks, during which the nurse can decide whether or not to utilize PTO through the requested furlough date. For nurses who agree to a voluntary furlough, the hospital will continue to maintain health insurance coverage under the group health plan, which is awesome. Though the hospital will make every reasonable effort to avoid early recall from furlough, the hospital may seek to recall a furloughed nurse during their furlough dates if volumes unexpectedly increase. Nurses shall be provided 24-hour notice of recall. We had to fight hard for that. Nurses may be recalled with less than 24 hours notice only with mutual agreement. Requests for voluntary furlough will be prioritized considering the following criteria and are anticipated to depend on the mix of nurses who apply. So here's the criteria they're going to look at. So the one thing to think about with furlough, it's a voluntary period of time off. You can volunteer for it or not. What it's going to do is going to give you time off. And the reason that they are so adamant about the ability to recall during furlough, because Mary can speak to this. We really did fight to try and just have a furlough be a furlough, and you have your 2 weeks or your 1 week or whatever. But this is what I'm seeing right now, and this is actually just happening across town, you guys. There is a department that is now down 4 nurses, 4 out of 8 nurses. It's a small department because of COVID-19 positive cases and COVID-19 exposures. They're on 14-day quarantine. So if that department had nurses who were furloughed and had the ability to recall them back because of that, they would be in a safer spot than they are right now. I'm not sure what they're going to do to try and to make this department safer and these nurses to not have to work 14 hours. So just like, there is rationale behind why they want the recall. It's not 24-hour notice was a hard push to get, wouldn't you say, Mary?
Yeah, I don't want to say everything was a hard push, but that's me.
Yeah, I think the officers were very optimistic about the idea of voluntary furloughs, that the nurses get to choose if they want to do it or not. That's on a voluntary basis. But the idea of recall was something that required a lot of discussion.
Leslie, you're muted.
I'm
You're
dealing-
muted.
I'm
Yep.
dealing with a preschooler. So
Oh,
there
okay.
were some stern words that needed to happen. Smile. Okay, so the next piece is a reduction in schedule. This is different from a furlough because it would be like moving from a 0.9 to a 0.6 FTE or something along those lines. And it's a voluntary reduction in the schedule, during which a nurse can decide whether or not to use PTO to make up for the dates that they're not being scheduled. The reduction in schedule may be expanded or reduced with mutual agreement between the hospital and the nurse. For nurses who agree to voluntary reduction in schedule, the hospital continues the health insurance coverage under St. Pat's. Requests for schedule reduction are going to be prioritized according to the same as the furlough. So this is just another option to try and reduce hours without having to lay people off, basically, get rid of positions. So the hospital, the next bullet, the hospital will consider reduced schedules in accordance with the current collective bargaining agreement. There's language in the agreement that allows for changes in schedule, that allows for layoff, that allows for immediate layoff with minimal notice under emergent situations. And COVID-19 is a health emergency. It is considered an emergency. So do note that like those things are already outlined in the contract that management has the right to do, and this MOU was trying to give some more flexibility to avoid that having to happen. So next bullet point, with appropriate permission from supervisor/manager, nurses may attend department meetings through telephonic or other virtual means, which is great. I don't know if you guys are doing this very much, but I really think that you should. Most facilities are right now. The next bullet point, parties recognize that this is a unique, fast developing situation and commit to ongoing dialogue around these issues. If requested, St. Pat's and MNA agree to discuss, reevaluate, and if necessary, bargain regarding the terms of this agreement on or before October 15th. The provisions described herein, so we can really bring this back up and re-talk about it at any point. Except as otherwise explicitly provided in this agreement, terms of the applicable collective bargaining agreement between the parties will remain in effect. Nothing in this agreement is intended to prevent a nurse from accessing other state or federal benefits for which they may qualify, including unemployment. This agreement shall be effective upon signature and shall continue through December 31 of 2020, with the option to extend this agreement with mutual agreement between the parties. This MOU will not be extended without the agreement of the nurses. Okay, so that's the agreement, this red being the only thing that's changed. I left it red for easy to see. That's that. I'm going to leave this up just with this one change here for a couple more minutes, and then I'll take the document down. So the goal behind this, and Mary, you can parrot me and echo what I'm saying too, is that we had a lot of discussions. Dear Lord, help me. We had a lot of discussions, and the goal is to try and, if COVID-19 cases increase, if it affects your census drastically again, if there are departments where there is not enough work to keep the nurses busy, to keep all of the nurses staffed, to try and avoid having to lay people off or having to mandatorily reduce their schedule. That's the goal of this. So the plan for the vote. So what I'm doing with this recording, we're going to send it out to all the nurses. It'll be a YouTube link. Mary, are you laughing at my kid that's making all the noise? Thank you.
Just a little bit, because I'm trying to read your lips, actually.
She's been home with me since March, y'all, and the struggle is real. So we're going to post this for everybody so that they can watch it, get the same information. And then the vote is going to start on Monday of next week. I'm going to make it go out first thing Monday morning, and it's going to close Thursday at midnight. And then we'll have the results Friday morning. Okay, so that's the plan right now. I'm going to take this off my screen. And so that's the plan right now. And what we're going to do is send notice out to everybody. Hey, Jim, I see your face there. And if for whatever reason you guys have had any issues with receiving ballots, with receiving updates from the local, with whatever, any nurse who's brought those issues to me, we've been able to troubleshoot and figure out what the issue is and get them their ballot or get them the information. So if you're hearing that nurses are having issues, send them my way, tell them to email me or text me. It's very easy to fix. I just need them to let me know, okay? So that being said, we have about 12 questions to go through. Mary and I both have them, and we're going to take turns answering them as best we can. So the first one is, what are administration plans right now? Do you want me to answer that?
Yes, please.
So obviously, I just know what they tell me, right? I don't read their minds, but as far as we know, the plans are status quo. They're going to keep doing what they're doing until there comes a point, if there's a drastic increase in cases, that needs to decrease scheduled procedures, or people stop coming to the hospital for non-emergent things, which they do. If there's a decrease in census, then this will start coming into play. But if the census remains as it is, there doesn't seem to be a huge need for more low census, more mandatory low census. There's still the option of doing voluntary furloughs or voluntary hour reductions if you guys want to request that within your department. But from what I'm hearing from the hospital, from what I'm hearing from all the nurses, that census is high. Census isn't low enough to need low census right now. So these are not issues for right now. This MOU is a just in case. They need the flexibility if a second wave hits before December, if the wave that we're dealing with right now gets out of control and people go back to school. It's just to give them the flexibility for staffing and scheduling if the census drops again. So second question is layoffs. There's a lot of questions about layoffs. The first one is, can they lay us off? And the answer is yes, it's in your contract. They have the right to lay off. It says that they're supposed to provide 30-day notice, and except in situations that are emergent or emergency. And that's what this is considered. It's a health-wide public health emergency, statewide public health emergency, excuse me. So, they have the right and the ability to lay off and to reduce schedules. So this is trying to avoid getting stuck in that situation where that's going to have to happen. If you do get laid off, do you get unemployment? Yeah, but you don't get health insurance. Your facility provided health insurance does not follow you during a layoff. So I'm not sure what that means. I don't know if you do COBRA or you get on is there an unemployment health insurance? I don't know. I've never had to file for unemployment. I'm not a guru when it comes to unemployment. But I do know that if you get laid off, you don't get to keep your health insurance through the hospital. But if you do voluntary furlough or a voluntary hours reduction, you do get to keep your health insurance. And so that's one of the benefits there with doing those options instead of just going straight to layoffs. Layoff versus furlough. So they're fairly similar. Like, what's the difference between one versus the other? The big one is the health insurance. I think under a furlough, depending on the length of furlough you're going to, you do qualify potentially for unemployment as well. So you could still get unemployment paid through unemployment office. It probably wouldn't be 100% of your pay because that $600 a week is gone now. but it might come back. Who knows? There's always talk about that. Those types of things. The biggest issue is health insurance. With a furlough, you'd get to keep it. With a layoff, you don't. We talked about FMC and mandatory low census. And Jim, you can kind of speak to this too if you want. Just we've had so many discussions over the last 3 years and throughout negotiations about those nurses getting mandatory low census on the regular. That's what prompted a lot of discussion about excluding them from increasing the MLC caps, because they would see an immediate and direct issue with that, where the census in their department is not affected by COVID. There are still mommies having babies, and there's still census in that department hasn't changed really since COVID hit. And so this MOU is really about COVID low census. It's not about general low census for FMC, which they deal with on a regular basis. So that's why they've kind of been carved out. So Mary, do you want to take the "we're busy, why do we need this MOU" question?
Well, I think you answered that already, was that this is an in case kind of thing, because we really don't know what's going to happen in the rest of this year or the year after that. And I think they were very concerned, obviously, about, well, if it gets really bad again, what are we going to do? So I think they want this as a plan in place ahead of time, as opposed to trying to come up with it in an emergency time again.
Yeah, I think that's a really good point, is trying to have a plan in place ahead of the emergency. And you're right, they did mention that several times. So yeah. The next question I have down here is, how does this MOU benefit the nurses? But it wasn't really a question, it was a comment that said, I don't see how this benefits the nurses at all. That's not 100% correct, but I understand that. And I think, Mary, I think you do too. This isn't an MOU that's saying, here's all these things we're giving to the nurses. That's not what this is about. This is about, if there comes a time when there are departments who are suffering because of census, sharing the load of that amongst the whole group of nurses when possible, by redeployment, by furloughs, by whatever, so that there isn't just a couple of departments that are hit with layoffs and you have 50 of your nurses laid off without work and without health insurance. It's trying to share that and trying to equally distribute it.
Not to interrupt, but Leslie,
No, please.
what about do they also suspend our retirement and that also?
Oh yeah, because your retirement, if you're laid off, you're not working there anymore. You have the ability to go find employment elsewhere if you want to, but that's not necessarily going to be an easy thing. If you guys are hit so hard that we're going in that direction, I would assume most other healthcare facilities are as well. And so finding another nursing job that isn't a travel assignment might be difficult. Yeah, so your retirement, all your benefits would stop. Okay, so mandatory low census and unemployment. How do those work? I don't know. If anybody knows some details on that, let me know. I think it depends on how many hours you're losing and if you're losing them on a regular basis versus 1 week out of a month. I think when you lose income, it has to be a regular loss of income. This is all my understanding, but I'm not an unemployment person. I'm not a guru. There are people in the unemployment office that can answer this better than me. And honestly, the benefits for unemployment during COVID-19 are constantly changing. And they've changed in the last couple of weeks. Excuse me. Mary, do you want to talk about the next question? What protections do we have from layoff in the contract?
As far as I read, we don't. I know one of the nurses had asked, doesn't our contract protect us from layoffs? And it is specifically spelled out that, and along with, they say management rights, but they do have the right. Not only do they say they can lay you off, but that they can, they've got it set up that it will be based on seniority, and then also based on seniority on who gets called back. Mm-hmm. So it's something in there that can happen.
Yeah, and so what it is that layoffs based on the department where it's needed. Let me just open it up because I have it pulled up right here. it's in the order of reverse seniority. So the least senior nurse gets laid off first. And when they're recalled, the most senior nurse of those who've been laid off gets recalled first. Does that make sense? Yes, I see some nodding. Okay. You guys hear the craziness at my house. So, a question that I saw regarding layoffs. If they do layoffs based on seniority, how would that affect nurses working bids? So, right, you guys have your bids outlined, but if they're doing reverse seniority, a lot of nurses that are less senior work on night shift. So does that mean that there's going to be a bunch of night shift nurses laid off? And if that happens, does that mean that day shift nurses are going to be forced to work night shift?
I think so.
I would say, I don't know for 100%, but your management has rights to run their business. If they're laying off based on contract guidelines that say least senior, then the least senior go. And then there are staffing holes and scheduling holes on night shift. And yes, it is possible that day shift nurses will be forced to work night shift. That is absolutely possible. Is it going to happen? I don't know. I mean, there's no way to know for sure, but I would assume that they have every right to move a nurse from a day shift to a night shift based on the needs of the patient and the needs of the hospital. So yeah, that's possible. Question 11, I didn't get a ballot or an email or whatever. How do I fix it? I paraphrase these questions, I hope you don't mind. Again, if anybody didn't get information, they can't find information, they can't find the ballot, whatever, there's a reason behind it. They've either blocked SurveyMonkey, they've blocked emails from Jennifer, they changed their email address and didn't tell us. There's always a reason, and I can figure it out. I just need them to contact me. If you guys hear any scuttlebutt about that, please send them my way so I can fix it. Can we amend this MOU? Can we increase PTO? Can we get any changes right now? For the vote that's going to happen Monday through Thursday of next week, it is the MOU that I just showed you. Without any other changes, this is what you're voting on. What happens if the nurses vote it down? I don't know. Does that mean we're going to go back to the discussion and talk about changes to this MOU and present something else? I don't know. This could be the only MOU option that we'll have. It could be that management will look at it again and we'll try and adjust some things and get the officers to agree to it so you guys can vote on it again. I don't know. We didn't talk about that. We didn't talk about it at all. We just said that the nurses would get to vote on it regardless. So this is the MOU that we have. The officers, agreed to bring it to you guys to vote on. And this is where we're at. So whether or not it could look different, I don't know. Possibly, possibly not. So that's all the questions that I could kind of scrape up from everything that I read on Facebook and all of the questions that got brought to me from text messages and phone calls with different nurses. What other questions do you have? I have everybody on mute, but you guys should have the ability to unmute yourself. So fire away.
I apologize. I had to wait for a second because of my son, but
Not at all.
so is the language written such that if we vote yes on this and the MOU is agreed to, that a layoff will not occur, or that a layoff may still occur?
May still occur depending on the needs of the facility. There's nothing in this agreement that says that they will not lay off nurses, but this agreement is to extend their flexibility so that they can avoid doing that. From the first conversation, and Mary, you can speak to this too, they were very adamant that they don't want to have to go down that road, that they don't want to have to lay off nurses, they don't want to have to mandatorily reduce hours. They want it there so that it's something that the nurses have voted on or agreed to that gives them more flexibility to avoid those situations.
I guess I just don't understand. I mean, I understand why this benefits the hospital, but I'm having a hard time understanding how it benefits us.
Yeah, no, I totally understand.
I mean, it seems like we're making a big concession for them and not really getting much back because they could still lay us off.
Yeah, they still can. They don't want to, right? And in order, if things get to a situation like they had been, if there isn't, and this is what they've shared with us, if there isn't an increase in MLC, they're not sure that they're going to be able to avoid it. They don't know. Like, nobody knows what's going to happen in the next 6 months. but they want to avoid it. And the benefit being that if this change, this temporary MOU avoids getting one nurse laid off and losing health insurance, that could be seen as a benefit, even if just one nurse doesn't lose their health insurance. So, I mean, everybody's going to have their own opinion on if this is a benefit or not, but it's the idea of sharing that load so that there aren't certain people who, lose their income completely, lose their job, lose their benefits. That's the idea behind it. And some people will be on board with that and some people won't. And that's one of the main reasons the officers wanted to bring it to you guys, so that the majority of the nurses voting can decide that. Because you guys.
I mean, I guess the side of that though is like they're still. I mean, I know that this isn't up to you, but they're still hiring people. Like we've got.
Yeah.
I don't know how many new hires in the ICU since April or whatever. I mean.
No, and that's fantastic. I love that you guys have been able to continue doing that. But there are other facilities that aren't, and there are other facilities that were going in the opposite direction when everything was shut down. And the idea behind this is just in case we have to go back in that direction again, because we don't know. COVID cases, you guys have seen, have gone up a lot. They're kind of plateauing right now because testing is not as much as it was, and we're masking everywhere now. But who knows if that's going to continue and go down, if we're going to get a second spike. We don't know what's happening. And so the idea behind this is not to enact it right now because it's not needed right now, but it's to enact it if it gets to that point again. And if they're not going to be, I would assume they're not going to be utilizing these things and continuing to hire, right? Because that's counterintuitive and counterproductive. So I love that you guys haven't had to stop doing that, but we don't know what's coming. And to have this agreement in place before the emergency hits is what their goal was. So I understand that it doesn't look like a benefit to the nurses at all. I get that. And I don't necessarily.
It's a concession.
It's a concession.
I would look at it as more of a concession.
So can I kind of add on to that?
Yeah,
question?
please.
So when you think about it, why couldn't we vote this thing down and as a union, without the hospital involved, come up with the same agreement that we just say, hey, if this comes around, come talk to us. And as a union, as a group of people that work together, we'll make sure everybody takes some low census. We can come up with this without ever agreeing to it with the hospital. And I guess the other part and I'm not saying I get the point of doing this and all that.
Right.
But my bigger thought was with this when I read it, and it opens up a can of worms, and you're going to say we're not voting on it next week, is again what Megan said. What we're doing is giving something to the hospital, and they're not giving us anything back. And for an ICU nurse that is now taking COVID patients enough that I can never say to my friends, I'm 2 weeks out from taking care of someone, so I'm basically having to self-isolate it a lot. I'm not getting anything. I'm not getting extra pay. I'm just being put in this situation where I could be stuck doing this till next summer. I probably will, unless I say I'm not going to take these patients anymore.
Right.
So I see this as a total give to the hospital. Granted, it's not a big deal, and it's super important that people keep their health insurance. But being a nurse that's been at St. Pat's for 30 years and seeing all the things they've taken from me, including my EIB at the beginning of this year, and then seeing those articles in the New York Times that I'm assuming you guys saw this spring about how much money Providence makes and how they make more on their venture capitalist investments that they do on their health system. I have a hard time feeling like they're financially hurting.
I hear what you're saying. And as far as your question, it's like if it's voted down, can we do this? I mean, if it's voted down, we can try and do whatever. Whether or not it's going to be agreed to or not, there's no way to know for sure. And then also trying to come up with a plan that all of the nurses would then vote on and agree to too it's kind of what we're trying to do now. But yeah, I mean, we always have the option to bring ideas forward to management about these. So it's definitely a possibility, but where it will go, I can't guarantee anything.
And it's too late now, but why couldn't we have said, okay, here's what we're going to give to you. And the flip side is everybody who's taken these patients on 5 South and taken them in the ICU, gets extra pay for doing that, because it's majorly affecting their lives. And honestly, it's not just the nurses, it's the RTs, it's the HCAs that get stuck. We're proning patients. That takes a ton of people to walk in that room and get exposed multiple times. So that's a different issue, but it needs to be addressed.
Thanks, Paul.
Sure.
I don't have an answer, but thank you.
Yeah.
What other questions do you guys have? No, nobody? Well, if you guys think of stuff, don't hesitate to reach out in any way that you can. We'll do the best that we can to answer them. I'm going to get this and the MOU, the recorded video, sent out to everybody, the link at least, so that they can watch it. And if there are other questions that you guys have or hear that need answers, don't hesitate to reach out, and we'll do the best we can to get the answers out to everybody.
And guys, I guess I want to finish with that. I know when we're presenting this to you, I know there's thoughts that we're trying to sell it to you, and we're not. We're just saying this was presented to us. We worked through it and got the best that we could, and we're taking it to you. It's not a good time. I mean, we're doing great right now, but there is a lot of potential. If you've seen across the country, I guess, there's no guarantees. There's no guarantees from them of, if they take something else, Paul, or if they do. If we vote it down, I guess we're going to see what happens. And I'm not saying that in the means that you need to vote for this because they're going to do something bad. We don't know. We don't know what they're going to do. And I want you to think of it. That's the way we're producing it. We're not trying to sell this or sell you out.
Honestly,
it's just like,
I'm not saying I'm going to vote it down. I don't even know how. I get the point, and I get the shared. We're all in it together. Let's share the pain. I'm totally cool with that. But when Megan started talking, I was thinking, we could actually do this as just a union without the hospital involved. And I'm not. And it'd be harder and be taking it a step over again. I guess my bigger issue, like I said, was that when I read this the other day, I thought about it, and then I went to work and got assigned another COVID patient and started my 2 weeks again, where I'm telling my friends, because I'm older, who have pre-existing conditions, I can't be with you now.
Yeah.
Again.
Right. I'm just smiling, Paul, because every day we get someone, we're so in the ER. Patients come in and we're like, well, they don't have a cough and fever, but they do have diarrhea. So we're going to treat them as an isolation, maybe until the doctors, we have no idea. Yeah. So I get you where you're being exposed every day. I don't even get to go in knowing if they do or not. Yeah. Usually it's the ones that we don't expect, or the ones in our department is the one that's going to get us, but now that we're all universally masking, and the fact that the hospitals decided that, and I get that part because of HIPAA or what, but that we don't even really know for sure. There are some of the managers will speak to it, but they won't specifically speak to how many patients do we have, or who is and who wasn't, or we're, unless there's an exposure risk. And like I said, I understand. According to my boss, that's why we went to the face mask and the face shield, so that we're covering our mucous membranes, so that if somebody we don't expect that doesn't even have symptoms, they were kind of saying that this is supposedly going to cover us. If we have an exposure, that it would be considered, this is what my boss said, maybe he's wrong, but that it would be considered a low risk exposure, so you don't have to take the 2 weeks off of your own PTO.
Yeah, that would be interesting to see. I figured the face shield was for our protection.
Yeah, and it is, but they said partially too is they decided that, because we had a bunch of people that went outside of work that ended up with time off because they'd gone to a wedding. One of the people was sick, or wasn't sick yet, but had been exposed, and was wearing a mask at this particular wedding. But then a handful of them, because they were with her that day, had to take 2 weeks off. Yeah. And that was on their own time. And they were really upset about that.
Yeah, and it's going to get hard too, because if someone comes up positive, how do you prove you got it at the hospital or at the grocery store?
Right. At this time, there's really no way to tell, because this community, from which I read way too much, but this community exposure basically means they really don't know where they got it from. Somebody in the community that they didn't know was sick.
Well, and regardless, if you guys get sick, it would qualify, you should qualify for
Right.
short-term disability if you become sick with it.
If you get sick, but if you just
Well,
have to
but
take
you,
the time.
again, you can't, you have to say, did you get sick at work or did you get sick at the grocery store? And that's gonna, is
Right.
it a workman's comp or is it your health insurance? Which, that's in the weeds at this point.
Right.
And I don't have a problem with helping the hospital out. And in the grand scheme of thing, this, like you said, it keeps everybody employed with their health insurance as long as we don't go to layoffs.
Right.
And hopefully it won't get that far. I mean, nobody wants that.
Yeah, totally.
But nobody has control of it either. So that's the hard part here. This is such new territory for everybody.
Yeah.
And
I
there's
guess
no,
the bigger thing for me was just when I read this thinking, okay, so we're helping the hospital. Granted, we're helping each other too. But how about we talk to them about something extra for taking care of these patients? Because
Well,
it's basically shutting our lives down.
Right. Yeah. I'm working on my bridge troll thing. I don't go anywhere with it. It's like, okay, I'm just going to be, me and the dog are going to be out. Didn't we, Leslie, talk about this in the first that first MOU that we were talking, the emergency coverage of things and who would get covered and who wouldn't, that we had talked to them repeatedly about hazard pay for COVID patients. And they absolutely would not drug in their heels and would not bite.
Well, maybe we could bring it up in PCC. And if they don't, I mean, at this point, it sounds like we volunteer or say we don't feel comfortable taking care of those patients. So maybe what will happen over time is, less and less people will be willing to do it when they see it affecting their lives.
Is that the process right now? Is you guys have the ability to volunteer to take them or not volunteer?
That's what I'm hearing.
Okay,
Yeah.
that's interesting.
So I didn't know that.
Good luck for you, Mary. You don't know if they're positive or not until after you've already.
Yeah.
No,
Well, and that was the thing back in March and April. It's like, well, that does, so you say you don't want to take them. Well, now you got a patient that we just didn't test.
Right.
Right.
Are they
Nobody
positive or
was
negative?
tested back then. Yeah.
Yeah. It's better now, So, anyways,
Well, I sure appreciate all you guys joining. Is there any other questions before I stop recording and we kind of end the meeting? No, I see Jim shaking his head. Okay, well, if something comes up and you guys think of things, email, text, call, reach out to the officers if you don't know how to reach out to me or can't get a hold of me, and we'll do the best we can to answer all the questions so you guys feel like you can vote with some more information.
All right. So vote will be Monday through Thursday now. So with this more information, and everybody will have the chance to tell people, that they can look at this and, see if it answers any more of their questions. It's not good. It's not a good thing. It's like you said, it's not a benefit in any way, shape, or form. I feel like we're conceding, like, okay, maybe we can do this.
Yeah. And I think that, like, if you guys are hearing issues with the voting, just make sure people get to me so that I can fix it, because it's easy to fix if I know that it's going on. Okay.
and again, just so if you vote yes, it still ends December of this year. It's
Unless
done.
the nurses agree to extend it.
So
Correct.
we have to.
We have to meet before they
Correct.
decide. And go
And that
through with it.
extension too, we're going to have the nurses vote on. If it's an extension, it won't just be the officers decide. I think the nursing body needs to vote on it.
Yeah.
So, okay.
Okay. Well,
All right,
thank you.
guys. Thank you all
Thanks, you
so
guys.
much. Have a great night.